Broadcast is now starting. All attendees are in listen-only mode.
Is Jill Baker, who is the prevention, one of the prevention coordinators at the Oregon Health Authority, and Spencer Dell, who is our suicide prevention coordinator at Oregon Department of Education. So I'd like to begin by welcoming you and thanking you for joining us, and for apologizing for last week's webinar blunder. Hopefully this week everything will go well, and I see that a number of you have joined us, so thank you, and thank you for your patience having to put this off for a week. So the format for today is we're going to be going through a presentation for the first approximately 30 minutes, and we're going to invite you to list your questions or comments in the question area, question area and go to. And then after we finish our presentation, Spencer Delbridge will be reading your questions, and we will respond to as many as we possibly can. Oops, let's hope this works. Oh, okay. I guess you're not going to see us after all. So briefly, here is what we're going to cover today. We're going to talk about risk factors for suicide and warning signs. We understand that a lot of you are already very familiar with this information in your work, but some may not be, so we wanted to make sure that we're all on the same page. So we're just going to review some of this information for you. We're going to talk about things you can do to prevent suicide. Obviously, in the telehealth environment, we're dealing with different procedures and policies and practices, so we'll be covering that. We're going to share with you some really wonderful crisis response resources that can help to support you in your work, particularly in the telehealth environment. And we'll talk a little bit about some of the efforts that ODE and OHA have underway to help to reach students that have little or no access. And then we'll open it up to questions about what guidance you might need from us. So a little caveat before we dive into the presentation. ODE has updated our website. So if you go into the COVID-19 area, there's an area called mental health and social supports, and it is now divided into resources for students and families, resources for administrators, school counselors, and other mental health professionals, and also resources for educators and staff. Under the school counselor and other mental health professionals area, you will see below the guidance documents that there are tabs that include the website resources, the webinar resources. So there are links to each one of the webinars, as well as the PowerPoint presentation. And there are also links to future webinars as we get to continue to generate them. So that's where you can find all of the resources. And this session will be recorded. So if you aren't able to stay for the whole thing or need to share it with colleagues, there will be a link in that area as soon as we're able to post this. So all of the resources today will be at your disposal. So thank you again for joining us, and here we go. Oh, one more thing. Yes, so please do, if you have missed us, this should say go to question area. Again, any questions, please refer them to there. Please be concise in your questions so we can reach and respond to as many of you as possible. And again, the updates for all of this information will be posted on the website. And we apologize, but we're going to stay focused on this content today, so we're not going to be able to answer questions that are outside of the subject area. But if you have any other questions, we'll send you some contact information at the very end of this presentation. All right. So as you can imagine, in this COVID environment in particular, most of us are experiencing more than our typical signs of stress. And signs of stress in and of themselves are not problematic. probably as you look at this list, you might identify with one or more of them. But just to note that fear and worry, changes in eating behavior, difficulty with concentration, more health problems, particularly now feeling alone and feeling a need to seek social support, changes in mood and feeling somewhat avoidance of typical activities are all signs of stress. They, in and of themselves, are not problematic. They're just how we humans deal with challenging times. So it's important to discriminate between what are signs of stress and what are signs of distress. So in terms of suicide risk factors, that is when we consider moving from stress or a normal stress response to somebody who is distressed and is experiencing difficulty coping due to COVID or due to just general life circumstances. So there are a number of risk factors that the research shows increase the likelihood of potential suicide ideations, plans, or attempts. These include previous attempts at suicide, feeling extreme isolation or aloneness, self-injury or a history of self-injury, a history of, I would say, clinical depression, substance use, and behavior problems, high levels of stress, so above and beyond what you would expect as right now, what would be our normative level of stress, but a really personal experience of being very stressed and feeling out of control. A family history of suicide risk also predisposes people to suicide. Firearms in the home, again, readily accessible means, and situational crisis. And I think that we can all agree that at the present point in time, our experience probably qualifies as a situational crisis. So all of these factors, either in isolation or in combination, are things that we need to be paying attention to as we reach out and connect with our students, families, our colleagues, each other, and be mindful of the fact that one or more of these might be cause for us to pay more attention or provide more supports as needed. So moving from risk factors to warning signs, as most of you know, there are some signs that we need to attend to readily and also be consider them danger signs. One would be a direct threat of suicide. So again, someone verbally says that they don't want to live, they want to kill themselves. Plans, if someone articulates an actual plan to harm themselves or others, but in this case, we're going to talk about self-harm. Extreme hopelessness and despair. I think that goes without description, so I'll leave it there. Preoccupation with death or dying. And the things that you can visibly see, particularly, or hopefully at least ascertain if you can't visibly see a student, colleague, or family member, is radical changes in appearance, in behavior, in thoughts, and in mood. So all of these things, again, either individually or collectively, can be warning signs that we need to be paying attention to. So this moves to what you can do, and in our recommendations and our guidance, we are always very mindful to look at this work through a trauma-informed lens, as well as considering social emotional learning supports and equity and access. So the thing that you can do first and foremost is to provide emotional safety for someone who is expressing any one of those suicide risk factors or plans. Create a supportive and trusting relationship as much as possible. Make use of support resources, which we will be sharing with you shortly. Try to work to scaffold, particularly if we're talking about youths, create networks of supported adults. In many families, that might be relatives, it might be friends. I respect the fact that it's difficult now to be creating networks because we are not able to see each other, but creatively thinking about how to connect people through whatever medium is available. particularly thinking about never ignoring signs of suicide or keeping information secret. I know sometimes when someone discloses information that they're considering harming themselves, they're also acutely aware of the fact that for those particularly who are mandated reporters, that they may not be able to keep that a secret and may be afraid of the consequences of telling you that information and ask you to promise not to disclose it. But that's not in our purview, so it's important never to promise to keep that information secret, and to get immediate help if the threat seems serious. As always, our work at ODE is grounded in a racial equity lens. And so it's important for us as we do this work to remember that individuals and families respond to stress and crisis in very different ways. So we can't anticipate that what is true or what looks like suicidal behavior for one person is going to be similar for the next person. So it's important that we be culturally responsive in our work and that we identify the needs of a particular person or family, as well as their strengths. There are many families that have great depths of resources available to them, support systems, whether it be family members, faith, and it's important to ask a family or a student about what type of internal supports and internal family supports, and again, recognizing that not all students will have this, but asking what supports do they have available to them? What strengths do they bring to the table that we can focus on and leverage and elevate in our work with them? And also being mindful of the fact that, as I'm sure you know at this point, there's a great deal of variability in access to technology, broadband devices, and internet. And so we're working, and we'll say more about this in a little while, but we're working to find creative solutions to reaching families and students that are in need. All right, great. So at this point, I'm going to hand it over to Jill because I can't see you. So go on, Jill.
I'm here. Hello, everyone. My name is Jill Baker. I work with the Oregon Health Authority as one of 2 youth suicide prevention coordinators. One of the things that Oregon Health Authority has done in this COVID world, and Grace, I lost your screen, the PowerPoint, just so you know.
Is it back?
Yeah, it's back. One of the things that Oregon Health Authority has done is try to create a team of folks focused on the issue of suicide across the lifespan, including youth suicide. And so one of the resources that I wanted to just elevate and show you all is this telehealth tips clients with suicidal risk. So this is a linked document that you'll be able to access from the PowerPoint when we're done. There are, I don't know about you, but my inbox is completely full of guidance and tips and webinars and that type of thing. This document is really, really good. So I would highly encourage you to look at it and share it widely. We adapted it, Oregon adapted it from a document out of New York. And so there's not only really solid telehealth tips for clients or students with suicidal risk, but also Oregon resource specific. And so it's a well done document. It includes tips on screening students for suicide, safety planning with students, and then kind of recommendations for how to contact and connect with crisis services if risk is present. And so it's a provider lens, and so it might feel a little clinical or a little therapist-y, but there's lots that school admin and school counselors and other school-based mental health staff will be able to find useful in this document. Particularly, I wanted to highlight that there's a suicide risk assessment link within that document, and so if your school system is looking at how you screen students for suicide risk, there's some good trainings that are free online or OHA sponsored online, as well as ideas for suicide safety planning. So particularly, there are some good apps that we found that help students kind of run through the best practices, the evidence-based practices for what to include in a safety plan until they can access provider support. And so that information is included in this document as well. Two of the things that I wanted to highlight, one is that I didn't know about. I was a school counselor for many years, and I didn't know about these two resources that we have available in Oregon. One is called Reach Out Oregon. Reach Out Oregon is a website hosted by the Oregon Family Support Network. It has a ton of resources and information for parents or caregivers of kids that have behavioral health issues. So not just mental health, but addiction or other mental health disorders. And so it's an amazing resource for parents who are feeling overwhelmed and need some extra support from folks that get it. And so the Reach Out Oregon has a warm line for parents to be able to text other parents who have had kids with behavioral health issues before. And then Now Matters Now. This is DBT, dialectical behavioral therapy skill ideas for clinicians, but looking at it as a school counselor lens, it's got great adaptation ideas for schools. And I think a lot of them would be really helpful in a virtual distance learning environment as well. So that document is linked in the hyperlink, and then the actual where it's living on Oregon Health Authority's website is down there at the bottom. That's the same two links. You can go to the next slide, Grace. The other thing that I find exciting about this document is that we placed in there training that's available. And so not just some of the, so different levels of training from very basic, how to recognize signs of suicide and what to do about it, to some pretty in-depth, how to work with a student or a client who has suicidality, especially if it's an ongoing thing. That's one of the things that's a really hard balance to strike when you're supporting a school student in a school, is what do you do when it's not a moment of suicide risk and then goes away, but that it's this continual journey of working through those thoughts. So I wanted to highlight a couple of trainings that Oregon Health Authority is, because of COVID, sponsoring for free. The first one is called CAMS, Collaborative Assessment and Management of Suicidology. So there's two parts to this that I would recommend for school folks. One is the CAMS base. It's a 3-hour online training. Again, it is a suicide-specific intervention to lay on top of whatever other theoretical orientation you might have as a counselor. And so for school counselors that work with a lot of social emotional learning and social emotional risk, this would be a very good one. For other school-based mental health staff, this would be a great one. And then after you take that base course, there's a teen module. So if you've already taken CAMS, you can just take the teen module. But if you've not taken either one of them, you have to take the base first. And it's specific to how to work with students who are in the school age range. CAMS also has a telehealth specific adaptation that is for free on their website. These two cost, and so in order to get signed up for those trainings, you email my good friend Maria Poss at her email address right there. And what will happen is she'll email you a code to be able to take that training for free. And the requirement is that you give her your name, where you work, and what your level of interaction with students are. Grace, you can go to the next slide. Number 2 is Counseling on Access to Lethal Means. So this is a free online course as well. Again, these links are in that document that I referenced 2 slides ago. So all of it is housed within that same document. CALM is it's a easy kind of how to talk someone through restricting or creating safety for lethal means. Something like how to lock up the firearms, suggestions for putting medication in a trunk, or other ways to kind of create safety within a home environment. And so this is something that it's good to just kind of get the language in your vocabulary for how to talk parents through that, about how to create safety for their kids in the home. I mentioned a rating scale. So if your school district does not yet have a standard way to assess suicide risk, the Columbia Suicide Severity Rating Scale is a good one. It has free training online, and it's free to access online, and it's one of the ones that is most widely used and evidence-based. And then we have a 1.5-hour super basic suicide warning signs called Question, Persuade, Refer, or QPR. I know many of you have tried to register for that, and it fills. So we initially started with 5 offerings. They filled that day. We put in 5 more. They filled that day. And so email that email address that's down there on the slide. It's also in the document that I referenced, and they'll schedule one for your school district. And that's going a little bit better than trying to widely offer them. Next slide. So one of the things that the Oregon Health Authority, even before COVID, was trying to do was to kind of lay out this framework for school districts and communities, thinking about suicide prevention. So before there's any risk, how do we create wellness? How do we create kids who are able to regulate their emotions, are able to kind of name when there's a problem and access their own internal and external resources to feel better? As well as then suicide intervention. So how do we train everybody, staff, parents, kids themselves? How do we train folks to know what the warning signs are and what to do about that when they recognize them? As well as helping schools after a suicide death, how schools respond and care for their school community in that moment is suicide prevention. It creates some protection around other at-risk kids within that school. And so these 6 programs, Grace, you can go to the next slide, I think. Oh, lovely little animations there. Yep, there we go. These 6 programs are widely available statewide. Each of them, and the slide before you kind of saw where they land on the river analogy for way upstream versus after a moment of crisis. And the contact information for each of these programs is listed on this slide. If your school or school district, I know, at least in my household, we are both, well, I was an educator, my husband is an educator. And in our household, there's either like moments of too much to do or moments of feeling like there's not enough to do in this weird world that we're living in. If this is a moment for your school district that you've got folks that are interested in thinking through suicide prevention, intervention, and postvention plans and policies, then I would encourage you to check out some of these programs. They're available at low or no cost to school districts, either through mini grants or through a statewide training collaborative. And so looping through and really making sure that your school district has a solid suicide prevention, intervention, and postvention plan is one of the most protective things that you can do for your students. And I know that thinking of one more thing in a COVID world sometimes is difficult, but if there's brain space for it, the resources are out there, and we've got folks in each of these categories that are interested in helping. You can head to the next slide, Grace.
Coming back off mute.
Yeah.
Just in response to some of those questions that we've been getting on the question panel, and thank you very much for asking. All of the resources that we're mentioning are going to be posted on ODE's website in the COVID-19 area under mental health and social supports in the school counselor and other mental health professionals area. There is a tab near the bottom that says resources, and the webinars, the PowerPoints, and all of that information will be located there for you. So if you're not seeing anything, or you want to go back and refer to some of this information or click on the links, that'll all be available on our website. So in terms of suicide, if a student is at risk for imminent harm and you can't conduct a formal assessment, obviously the first order of business, if you have no other resources at your disposal, is to call 911. And here are, again, we're probably preaching to the choir here, but here are some of the preferred or recommended suicide resources in our guidance. We do have a specific document in the area that I mentioned on the website specifically addressing how to prevent suicide, as well as telehealth tips for clients with suicide risk. And as someone had asked previously, we do have telehealth guidance now in that area as well. So I'm not going to continue to just read this to you, but I am going to hand this back to Jill, who's going to tell you a little bit more about the Lines for Life remote risk assessment and safety planning wonderful thing that we now have in Oregon. Whoops, there we go.
One of the things that we kind of were brainstorming prior to COVID was the ability for school districts that have limited or fatigued resources to be able to have supports for actually screening suicide, screening for students for suicide risk. And so the concern that typically was in a conversation around rural or frontier Oregon now became something that was applicable to most schools in Oregon, kind of thinking through this. So this line is new. It's a month old, and so if you've not heard about it before, that's why. What the hope is that it can be kind of a safety net for schools, so that we don't want to take away the careful planning that you all have already gone into who gets referrals of students for suicide risk and what you do with those. But if there are moments when your school, your normal route to getting a student kind of screened, that initial screening for suicide risk, again, important to remember what Grace just said, that if a student's in crisis, call 911, get them to the crisis services in your area. However, if it's a question mark, if there's something that, like, I think this student should be screened for suicide, that this line is available through Lines for Life. It is staffed Monday through Friday, 8:30 to 4:30 by master's level folks who are highly trained in the Columbia suicide severity scale that I mentioned earlier. That folks can be able to call and this number with a student, and I'll go through kind of the flow chart of what we're hoping that looks like, but to be able to link them with somebody who has this, the training and skills to be able to assess for suicide risk and do a safety plan and refer to outside resources if necessary. So right now we are asking that only school counselors, school administrators, or other school-based mental health professionals are the ones making that referral. And that's important in that in capacity conversations, as well as being able to know that whatever the communication flow or policy within your own school districts are held to, if that makes sense. So that way, whatever the parent communication policies that you hold in place, we want that to be held at an administrative or school counselor or other mental health professional level. And we want to be very, very clear that best practices are that adults who already have a trusting relationship with a student and already are connected to a kid, that suicide risk assessment screening will go better and be more, it'll go better if it's done by an adult who already knows that student and who already has that student's trust. And so we're not trying to take away from systems and relationships that are already existing. We're trying to support and have a safety net for schools and school personnel who might need it. Grace, you can go to the next slide. So this you cannot read, but this is a flow chart, and it will be linked in the webinar for kind of what levels for the flow chart of being able to refer to that line at each level. And so our hope is that when a student is identified at risk, that if at all possible, that a three-way warm handoff happens to the referral line. So it's not just the school staff calling the Lines for Life remote suicide risk assessment and safety planning line, but that the administrator or school counselor or whoever is connected with that child or student calls with the student and parent for that suicide risk assessment and safety planning process. as well as all the way through kind of what to expect on the school side as far as looping back to you about how that screen and safety planning went, as well as that Reach Out Oregon connection again, so that way every student and parent who is referred to this line is also offered a support person who has experienced this kind of experience before. And so through Reach Out Oregon, that warm line network. We are very excited about this. It's one of its kind as far as we know. And we wanted to make sure that school staff begin hearing a little bit about it more broadly so that it can be utilized in the way it was intended. Grace, you can head to the next slide. I think I think it's you again. Oh, I think you might be on mute, Grace.
I was on mute. Thanks, Jill. There was one more thing that we wanted to mention before getting your feedback, and this may respond to some of the questions we're seeing on the chat. But one of our priorities at ODE, in and outside of the COVID environment, is to make sure that families and students have access to all of the mental health and non-mental health supports that they need. And so in support of that effort, in the last number of weeks, ODE has sent out 2 surveys looking at what districts have available to them and families have available to them in terms of broadband access, access to technology, et cetera, so that we can be responsive and understanding of what conditions families are experiencing and what districts are experiencing in trying to reach their families. And so in the not too distant future, ODE is going to be hosting a digital divide summit where we spend a little bit more time unpacking this because, you know, if you're following the data around COVID, I think that there's the immediate response that we've all been heavily engaged in with you. And there will probably be successive approximations of other responses over time that we're going to need to be all engaged in together. So thinking about how does this digital divide impact access and what we can do to resolve those issues to the best of our ability. We have also been working in a wonderful collaborative partnership with Oregon Health Authority around a number of other issues to provide increased access to families and students and educators and mental health professionals. One is we're working on launching a media campaign. OHA is directing that effort, and that media campaign will be specifically, the ODE piece of it will be specifically devoted to providing additional mental health guidance and resources and supports to students and families. It's a super exciting initiative. We're really grateful to be partnering with OHA on this. In particular, because part of the plan is to equip community-based organizations with this information because they're on the ground closer to you in communities and they will have broad access to families. So that's just one piece of the work that we're collaborating with OHA on. And the other is that we are in a serious conversation right now about how to create increased access to services by meaningfully engaging community-based organizations and possibly traditional health workers in communities to provide additional scaffolding and supports, not only during COVID, but afterwards. I think that this situation has brought to light the fact that we need to do more scaffolding of school districts and scaffolding of families by creating webs of support, and that's a big part of what we're doing. So having said that, we're going to, Spencer Delbridge is going to be joining us and reading some questions, and then Jill and I will do our best to answer as many as we possibly can. Hi, Spencer.
Hi, everyone. Sir, just if you'd like, just go ahead and put your any questions in the chat box, and we'll get to as many as possible.
Oh, and just to be clear, it's the question box, not the chat box. We figured that out last time. So, are they appearing in the chat too, Spencer, or just in the questions?
Yes, they're appearing in my chat, and I'm not showing a question box.
Oh, interesting, because I don't see chat. So wherever you put them, one of us will be looking and answer as many questions as we can. I saw quite a number of them up there. Spencer, can you see them?
No, I'm just showing audience question.
Okay. Well, maybe I'll go ahead and start reading them, and then if you find them, we'll jump over to you. So the first question that I'm seeing, thank you, Michelle, is do we have any data on whether or not there are rates of increased rates of suicide attempts or hospitalization in the state? Jill, you may be more equipped to answer this. I do know that there have definitely been increases. I don't have specific data. I don't know if you have access to that, Jill.
Yeah, so one of the things that the Oregon Health Authority suicide prevention team has been doing is that each week we do a scan of several different data sources. One is the medical examiner's kind of mortality report, the emergency department, both admissions and visits for suicide ideation and attempts, poison control data numbers, lines for life calls, and we're trying to get into the Safe Oregon tip line to see kind of what students are reporting about other students as well in the area of suicide. So emergency department visits overall are down for all categories, including suicide. And so that is something that that is an interesting byproduct of telling folks to kind of stay away from emergency departments. That's one thing that we want to get the message out loud and clear about, is that it is still okay to go to the emergency department for suicide risk. In fact, that is where you should go. Every single emergency department in the state is open and available for that purpose, and that is where the system exists for students to be able to get access to higher levels of care, like inpatient psychiatric services, and there are beds available in for inpatient as well. And so all of the systems are still the same and available throughout the state. We initially saw a spike in youth suicide numbers around right at the beginning of our COVID experience as a state. Since then, it has leveled out, that there's not an increase of suicide death. And so we don't know, none of us really know, because none of us have done this before. But when we look at kind of lit reviews of natural disasters or economic disasters, it's actually pretty common for there to be a lull or a dip in rates of suicide as the crisis is happening, and then it kind of returns to what would be an expected rate or occurrence of suicide. And so it's something that that we're watching and monitoring. We're asking for a report to be able to get out so folks can actually see numbers, because I think that's what I would want. As a parent of 4 kids in the state of Oregon, that's what I would want to see as well. And so we're working on that to be able to release the actual numbers so folks can see what those look like.
Great, thank you. The next question is, could you please share what specific virtual counseling platforms you recommend mental health practitioners who are working as school counselors utilize for suicide assessment and follow-up? Thank you for that question, Amy. Specifically to suicide prevention and follow-up, we have a document that Oregon Health Authority has shared with us that Jill referred to. And it is in the, again, ODE's COVID-19 webpage under mental health social supports in the area that is designated for administrators, school counselors, and other mental health professionals. If you look down, there are a number of guidance docs, and one of them is OHA's document specific to telehealth around suicide prevention. ODE also in that area has a fairly comprehensive document around specific telehealth platforms and requirements and legal considerations, etc. So both of those questions, I hope, are sufficiently answered by one or both of those documents. Did you want to add anything, Jill?
No, just as a human being, that anytime you can have your face see another human's face, that's protective. And so working, of course, within your district's guidelines. I know some districts are discouraging video conferencing. And as from a mental health standpoint, that I would encourage to work within your guidelines, but whenever you can see somebody else's face, that increases human connection and protectiveness.
Good point. Thank you, Jill. And it's always important to emphasize protective factors. And as we mentioned earlier, suicide prevention isn't just about intervening when someone is already actively suicidal. It's about preventing them from feeling the hopelessness and the isolation and the despair that gets them to that place of feeling as though there's no other option. So thank you for mentioning that. Oh, Zoe said it's a really good handout. I agree. I think she's referring to yours, Jill. James says, for those wanting to teach dialectical behavioral therapy skills, DBT trainings are highly recommended, and fidelity to DBT interventions is very important. I think both Jill and I would agree to that.
Yeah, and I'll just mention in there that I think I kind of casually said that you can adapt some of these, and that DBT is a really specific, intensive, evidence-rich way of working with folks with suicidal risk. And so I was more just referencing some of the good practices in being able to check in and skill building and that type of thing. Yeah, thank you for saying that.
Yeah, and just to clarify, in response to an additional follow-up question, I'm sure that this also goes for Oregon Health Authority, although I can only speak for ODE, but we absolutely, our guidance includes using evidence-based interventions and field-tested interventions at all times, and that's a real priority for us. Jill, I'm assuming, yeah, okay. Okay, this one is for you, Jill. It's from Shaylin, sorry. If a referral is made to the safety planning line, which is Lines for Life, will the planning line reach back out to the school staff member to notify of the supports provided or ongoing needs identified? Great question.
Great question. Yes, is the short answer. The long answer is that depending on the level of risk assessed and the age of the child and whatever consent is received from the child and their parent, you might get more or less information about what supports were given, but you will at least get confirmation that a screening occurred and that supports were given. And so because of confidentiality in some of those pieces, you might not always get as much as you would like as far as information back, but the short answer is yes, that there is a warm handoff either back to the school personnel, which is the preferred method, that you're the trusted adult that referred, so we want to close the loop back to you, and or the Reach Out Oregon Family Support Network peer support for parents. And so if you're unable to kind of hold that responsibility to walk with that family and self-services are able to be in place, that Reach Out Oregon is also available as a safety net there.
That's a great segue to our next question from Whitney, and she wanted to know, how are folks with Reach Out Oregon vetted?
So in this particular scenario, Reach Out Oregon is larger than what we're using in this context. But in this scenario, that only staff members would be asked to be that caring contact until students and families are able to be linked to services. And so they go through a peer specialist training and certification process, and they are staff. So that's how they're vetted. The parents that are on the chat line, the warm line, they are volunteers. And so they're vetted through by the Oregon Family Support Network staff, is my understanding. And we're not using volunteers for this service. We're using staff members.
Good point. Thank you. All right, this is a question from Nicole. It says, so if I have done a screening and it appears that there are risks, I usually call the crisis line in her county and loop them in with the parent. Are you suggesting we use Lines for Life instead of this crisis line?
Nope. I think that if you have a process where you have done an initial screening and you've assessed that there's risk there, then looping into your local resource at your local crisis line is the right path to take. This is in case there's not a U available in your school district to be able to do that initial check-in, initial screening.
Great. Okay, question from John. Are the numbers of referrals now during COVID much higher than they usually are for you? I'm assuming this means Lines for Life, but since Lines for Life is new, I don't know how to answer that, so I'll toss it to you.
Yeah, I'm not sure. Maybe John can verify what he means by that, because this line is brand new. It is less than a month old, and so there's not a baseline to compare it to. The Lines for Life call volume has been hard to track. It seems like they're overall the Lines for Life call volume of just folks reaching out to them with having crises or concerns about suicide are up slightly, but it's not alarming or overwhelming right now.
Question from Abby, is the teen-to-teen resource still available?
Yes, all of Lines for Life resources are still available, including the teen-to-teen text and chat service. That's available and staffed 4 to 10 p.m. daily.
Great. Well, here's a good question from Eric. What are some helpful things that we can communicate to our teachers and other school staff? Are there any trainings that would fit the teacher's role?
That's a great question. We are in the middle of producing a document for providers and professionals. The teacher piece of it, there's a couple of on there, and it has to go through, as a state agency, you have to go through 1,200 layers before anything gets approved. So it is on its journey to being released. There are a couple of webinars on self-care and emotional regulation. And so it's an interesting thing because helpers don't like to be told how to take care of themselves. But that is one of the most protective things that school staff can do for their students, is to find their own wellness in the middle of all of this, as well as some of those 2 webinars that I'm thinking about, or trainings that I'm thinking about, would also be good to kind of glean from for lessons or to give to students for social emotional kind of self-care type activities. May is Mental Health Awareness Month, and I keep thinking that it would be really lovely if we could have a pause for a day or 2 on lessons and classes, and lean into social emotional. Say that your lesson today is to find 3 things that you're grateful for and do those things, or that type of thing. That there's great value. It's not fluffy. It's scientifically rooted that gratitude and self-care and finding wellness is incredibly protective. I will say Sources of Strength, which is one of the big 6 suicide prevention programs on that river in the slides, that their website under their COVID-19 resource has some really good social emotional kind of worksheet type and lesson type things for teachers to be able to use. So it looks a little middle schoolery to me, but you might be able to adapt it up or down depending on what level you're at. If I was a classroom teacher, I would get excited about that website. And it's sourcesofstrength.org.
Yeah, thank you, Jill. Excellent answer. And having and working in schools and school districts with everyone from superintendents, principals, school staff, our tendency is always to think about caring for others first. And I always think that this is cheesy about putting the mask on first, but I think that the oxygen mask on first before helping others. But I really do believe that there's a lot of value in that, and that, if we allow ourselves to get burned out, which, again, I'll just speak personally, guilty as charged. I mean, there's so much work. It seems like it's endless. There's such a huge need. We feel as though we need to take care of everyone. And so I completely understand and empathize with that feeling. And with the full recognition that the choices I make about taking care of myself are going to have implications for the people around me, my family, other people that rely on me for support. So ultimately, I think that self-care is a radical act, and that we do need to be mindful of what we're able to do and when we need to stop. And that's really important. So a question from Satya, I think, really expands on this idea. She writes, the emotional aspect of the pandemic will be bigger and longer. What standard approach can we advocate for our community and schools to help with stress reduction, increase self-efficacy, cope with the changes that we can use across all schools? This will help us with prevention. I think this is the question that all of us that are in the mental health field are asking ourselves on a continuous basis. I'm going to respond to one piece of this question in particular, the word standard approach. Personally, I think that we need to think beyond standard approaches, and I'm not suggesting non-evidence-based approaches, but I think that we really need to be creative and innovative and nimble in the way that we're responding, not only to the pandemic, but just to the mental health landscape in general in Oregon. I think that there are a lot of tremendous resources available. Jill has shared a number of them. There's wonderful work in the trauma-informed space. There's wonderful social emotional learning programs, and so there's a lot out there. But I think ultimately it's up to districts and buildings and individual providers to work with students and families to figure out what works for them. And so the bigger that we can keep our toolbox of evidence-based and field-tested practices, the more we will be able to respond to individuals where they are. And that is a huge part of making sure that we're practicing and keeping equity as a lens, because one program, one standardized approach does not fit all. Every school building is different, every student is different, every family is different. So I would suggest, and we can definitely provide resources and guidance around, in fact, I know our website does have it, around specific offerings that might be useful. But personally, I would stay away from recommending any standard approach, knowing that every person is different, every family is different, and we need to really meet people where they're at, rather than thinking about having them fit into a standardized mold.
I would also add, Grace, that this is a weird time, that folks are grieving so many things, and that the other thing that is true is that when we try to tell ourselves we don't feel the way that we actually do feel, that tension is not helpful for students or staff or admin or folks at ODE or OHA or anyone. And so part of it, I think, the long game of this is to acknowledge that it's a long game, to acknowledge that this is hard, and to let yourself be a human who's also professional and can take a deep breath and get back in the game when you're ready. And so to kind of, school year is a sprint, and you give all that you have at every given moment, and this is not that. This is a long game where we have to kind of settle in and take good care of ourselves and those around us, because this is not normal, and I think it's okay to not feel normal or as productive or as on top of it as you normally are.
Absolutely. Thanks for mentioning that. I think that, you know, self-compassion is going to be a huge part of us helping each other and us helping ourselves to get through this, because it is a long run. All right, last question from Whitney. What are you doing to encourage school districts and local public health / mental health authorities to collaborate on preventing youth suicide during this time? I think, Spencer, if you're hanging out, I'm going to have you and Jill address this, because this is really your baby. Jill, why don't you start? I don't know.
Okay.
There you are.
There you are. Spencer, do you want to go first? You want me to tackle first?
Go ahead and I'll jump right in.
I'm using so many sports metaphors. I don't really like sports, like long game and tackling. Thank you, Whitney, for that question. I'm smiling because I think I know which Whitney asked that question. One of the things that we're doing is trying to build a structure statewide to stop being so terrible at communicating between OHA and ODE, educational service districts and school districts themselves. And no shame, no blame. It's just the nature of the beast. But we're working towards trying to be able to create ways to cross over so that folks know what each other are doing, so that communities themselves can respond to what they want their suicide prevention to look like. In the context of the Big Six and the context of Addie's Act, which requires school districts to create suicide prevention, intervention, and postvention plans, and in the context of the Student Success Act, which was highly focused on mental health. And so I will not promise that we'll be excellent at that, but I do promise we're trying. And there's some, yeah, and whenever suggestions or things that might be helpful come up, send them my way or Spencer's way. I think we're poised to have a really strong structure in Oregon. There's some thoughtful conversations happening, and I feel hopeful about it.
Yeah, thanks so much, Jill, and yeah, we're working to connect the work around Addie's Act for developing suicide prevention policies in school districts to Section 36 of the Student Success Act, which calls for the creation of a school safety and prevention system, and that's really work to connect agencies, to connect schools, to connect community-based organizations, to not only be able to provide programming, but also, as Jill and Grace are saying, a communication structure that really holds everything together.
Someday I'll figure out this mute thing. Thanks to you both. And again, much gratitude to the Oregon Health Authority. As Jill said, we've been working really closely together, not only around suicide prevention, about the larger issue of how do we create collaborative partnerships with school districts, among school districts, between school districts, within communities, with families, with community-based organizations, with local mental health providers. This is a big priority of ours to both of our agencies to create collaborative partnerships with law enforcement, with everyone who plays a significant and important role in the mental health of students and families and communities. And I am very grateful that we are able to collaborate with you today, Jill, and your wisdom is boundless in this area, so thank you very much. Again, just looking at this ODA website resources, these are the areas that you'll see under mental health and social supports. And here's our contact information for myself, Dr. Beth Wiggum, who is on this call and who is our school counselor extraordinaire, as well as Jill Baker at OHA. Again, all of these resources will be posted on the website. This webinar will also be posted on the website, as well as the PowerPoint slides. So on behalf of our group of wonderful and dedicated presenters and our agencies, Oregon Department of Education and Oregon Health Authority, We thank you very much for the hard work you're doing. We thank you for hanging in there, because we know that, as Jill said, these are unprecedented times. We are being challenged to look at our work and our world in very different ways. And we are all in this together. We are partners, and we appreciate all of your input and feedback. So we will be having another webinar shortly, so stay tuned. That information will also be on the website. And so now, have a great day, and thank you for watching. Take care. Bye for now.